This blog is talking about comparing standard versus low-dose CT scans in pediatric age group in terms of accuracy and safety. First study title is a multidisciplinary assessment of standard low-dose versus ultra-low-dose chest CT scans for pectus excavatum imaging. The research question was, can ultra-low-dose chest CT imaging accurately assess pectus excavatum severity compared to standard low-dose CT using Haller index HI and correction index CI as interpreted by both surgeons and radiologists? It is a prospective within subjects comparison study performed in a single center multidisciplinary academic pediatric institution. There were 32 patients with a mean age of 14 years. Each underwent paired standard low-dose care and ultra-low-dose chest CT scans. Measurements were performed independently by 3 pediatric surgeons and 4 pediatric radiologists. The outcome focused on the agreement in measurement of HI and CI between care and ultra CT protocols. The inter-class correlation coefficient for HI was 0.89, which means a good reliability, and for the CI was 0.91, which indicates an excellent reliability. Surgeon agreement was slightly higher for HI, 0.89 versus 0.88, while radiologist had slightly higher CI agreement, 0.92 versus 0.90. Bland Altman plots revealed no systematic bias between care and ultra approaches for either index. Imaging quality was sufficient for surgical planning despite the lower radiation dose. In summary, this study supports the use of ultra-low-dose CT imaging as a reliable alternative to standard protocols for assessing pectus excavatum severity. The high inter-rater agreement across both specialties for both indices emphasized the clinical feasibility of adopting reduced radiation protocols. The second study discussing the low-dose pediatric CT hair protocol using iterative reconstruction techniques, a comparison with standard dose protocol. The research question was, can a low-dose pediatric hair CT protocol using iterative reconstruction, I-dose 4, achieve diagnostic image quality comparable to the standard protocol while significantly reducing radiation exposure? This is a prospective single-center study that was completed in a tertiary care academic hospital in India. There were 214 pediatric patients aged less than 1 year and 1 to 5 years. 143 patients received standard dose and 71 patients received low dose. Indications included seizures, traumatic brain injury, hydrocephalus, VP shunt malfunction, and meningitis. The outcomes focused on the radiation dose indices and quantitative image quality, IQ, comparison between standard dose and low dose protocols. For radiation dose reduction, results showed for patients aged less than 1 year, 68% reduction in effective dose 0.91 millisievert vs 2.90 millisieverts. For ages 1 to 5 years, 58% reduction in effective dose 1.16 millisievert versus 2.78 millisieverts. For the qualitative image quality, there was no significant difference in subjective image noise, streak artifacts, or overall image quality. Gray-white matter differentiation was significantly better in the low-dose group, while the results for the quantitative image quality showed a higher attenuation and contrast to noise ratio, CNR, in low-dose protocol. Second, no significant difference in image noise or signal-to-noise ratio, SNR, between protocols. Third, excellent inter-observer agreement. ICC is equal to 0.9 for all IQ measures. In a nutshell, this study validates the clinical feasibility of using age-specific low-dose pediatric CT head protocols combined with iterative reconstruction, high dose for level 3 to reduce radiation without compromising diagnostic accuracy. The third study is discussing the performance of lung nodule computer-aided detection system on standard dose and low-dose pediatric CT scans, an intra-individual comparison. Research question was, how do adult-trained lung nodule computer-aided detection (CAD) systems perform on low-dose versus standard-dose pediatric chest CT scans? This is a retrospective individual comparison using data from a prior prospective study. 73 pediatric patients with a mean age of 40.7 years each underwent a standard dose and a low-dose chest CT during the same imaging session. A total of 247 lung nodules ranging from 3 to 30 millimeters were analyzed using two CAD systems, FlyerScan and MONAI. The outcome was the detection sensitivity of adult-trained CAD system on pediatric chest CT scans at standard and low dose. Results showed that both CAD systems demonstrated reduced sensitivity on low-dose scans. FlyerScan sensitivity dropped from 76.9% to 66.8%, and MONAI from 67.6% to 62.3% for nodules 3 to 30 mm in size, operating at 2 false positives per scan. The performance decline was more pronounced for nodules less than 5 mm. MONAI was generally more robust to dose reductions, especially for larger nodules, whereas FlyerScan showed greater sensitivity on standard dose scans but more degradation at lower dose. This study highlighted that the systems trained on adult datasets underperformed on low-dose pediatric CT, particularly for smaller nodules. These findings highlight the need for caution when applying CAD in low-dose pediatric protocols and emphasize the future need for pediatric-specific CAD development and training datasets. Take-home points. Low-dose and ultra-low-dose CT protocols in pediatric can significantly reduce radiation exposure while maintaining diagnostic image quality, supporting broader adoption in alignment with ELARA as low as reasonably achievable principles. For Pectus excavatum, ultra-low-dose CT provides reliable severity indices, HI and CI, sufficient for surgical planning without image quality compromise. Iterative reconstruction techniques enhance image quality in low-dose pediatric head CT, making them suitable for routine and follow-up imaging without sacrificing diagnostic confidence. CAD systems trained on adult data show decreased performance on low-dose pediatric CT, especially for small lung nodules, underlining the need for pediatric-specific CAD tools and training datasets. Thank you for watching.